Thank you, Doug. So in about 10 minutes, I'm going to reflect back a little bit on the last 20 years and see if we have made some progress. I guess I was chosen because I'm one of the elder statesmen here. I don't have funding from industry, although I have some advisory board contacts here. So I think many of you know that for 70 years or more, we've had a series of recommended dietary allowances, and then which are merged into the DRIs that made recommendations for essential nutrients, mostly essential nutrients. And as mentioned just before, fiber may not meet the exact terminology for essentiality, but none of us would be very happy without it. So the last DRIs, or the RDAs, were in 1989, so that was the 10th edition. And if I look back almost exactly 20 years ago, the Food and Nutrition Board began to ask the question, are we ready for an 11th RDAs? And to help answer that question, there was a public hearing in June of 1993, and from that it was concluded that a new concept using both the traditional deficiency disease approach as well as emerging concerns about nutrients and reduction of chronic disease was needed. And that resulted in a pamphlet report in 1994, how should the RDAs be revised? So in this pamphlet, a number of things came out, one of which is recognition that the RDAs were used for a number of endpoints and had to be some adaptability for use in labeling, dietary assessment, et cetera. But also potential roles of nutrients and food components, other food components in reduction of risk and chronic disease should be considered. Rational endpoints, and also we should be considering a great deal more than the RDAs did, the upper limits of safety. Moving forward to 1998, and this is part of the antioxidant panel deliberations, vitamin E, vitamin C, selenium, et cetera. There was a short report that came out. In that, they actually, a number of us were involved, defined the term antioxidants, discussed components that were not going to be reviewed by that antioxidant panel, and those were listed as phenols, polyphenols, flavonoids. They were excluded from DRI considerations 15 years ago. Why? There was a lack of comprehensive food composition data and knowledge of dietary intakes of populations, limited information on absorption and metabolism of these compounds. And while these dietary components, quote, may be important dietary constituents, insufficient data are available at this time. So these were important comments, and I think to some degree stimulated a lot of research, both here and abroad, particularly in Europe. I think we have come a long way, however, in the last 15 years. This same report stated the overall DRI framework includes a planned review by another expert panel of food components grouped as the other food components. Other data may emerge in the future to allow consideration setting for DRIs. Well, we never did get this other panel set up, so no efforts to establish this panel, particularly by the Food and Nutrition Board, have not come to fruition. So what amount of evidence is needed? This is somewhat already reviewed by Johanna, et cetera. Do we need randomized placebo-controlled trials, evidence-based reviews, can we consider totality of evidence? The issue is how much evidence would be necessary. Now, I'm not standing up here and say that we should change the standards of evidence. Standards of evidence is evidence. So we should not change whether one is considering drugs as essential nutrients or other components. Evidence is evidence. However, in my opinion, the issue is the amount of evidence that might be necessary. And the amount of evidence really depends upon, in my opinion, the risk-benefit ratio of that substance. So if we have say a potentially high-risk, lower-benefit material, and I'm just going to pick selenium here. So selenium supplements for cancer prevention. Well, selenium is highly toxic, so therefore it has a high risk, and it might have a low benefit. However, there are other components that are not considered as essential nutrients currently. Say, let's consider lutein and age-related macular degeneration. It could be highly beneficial to take more lutein since AMD is the #1 cause of blindness in older Americans. Is there much risk of consuming high amounts of lutein? Well, to be determined, but it's relatively safe. So Jeff Bloomberg's sitting here in the audience, and a couple others that were part of this report in Nutrition Reviews. What types of evidence are needed? Quote, because of limitations inherent in randomized controlled trials, particularly of nutrients, it's suggested that nutrient policy decisions will have to be made using the totality of the evidence available. This may mean action at a level of certainty that's different than would be needed for, say, evaluation of drugs. What are some challenges for accreditation of food bioactives? Lack of randomized controlled trials. Johanna and others have already pointed this out. Insufficient data for systematic-based reviews, which is the gold standard right now for DRIs. The cost of human intervention trials would be enormous, considering that many of these compounds have very small effects. Huge studies would be needed for a long time. Huge populations, and I'm not sure who's going to pay for that. Specificity of food component, Johanna pointed that out very clearly. Non-validated biomarkers, all of our panel members have brought this forth. Who's going to pay for it? And I think in general, for regulators, there's a fear of fringe supplement food companies by policymakers that might result in putting up some barriers against kind of accreditation of some of these compounds. Is there a consequence of inaction? I think so. Suppression of critical research to close gaps of knowledge. We have gaps. We've all acknowledged that. It leaves an open range for supplement claims. Further confusion by consumers. And pretty much it maintains a status quo for current food consumption patterns. That is, low intake of fruits and vegetables that contain bioactives. This is a quote from Lydia Roberts, who was on the first RDA panel, 1941. And from what we hear from reports, she was probably one of the driving forces for getting the first RDAs published. So she published an article looking back at RDAs in JADA 1958. One of the greatest services of the development of the DRIs has been to stimulate research, determine requirements for nutrients. So if we're not looking forward to establishing public health recommendations for bioactives, why should we do any research on that? Oops. Andrew Shao, this is a quote from 2010. What are the next steps? A paradigm for assessing the effects of bioactives is needed. Whether these are studied as nutrients or drugs must be established properly to inform future regulatory and policy decisions. Gary Williamson wrote 5 years ago in an article that looked specifically at polyphenol classes, made recommendations that daily intake recommendations, or AIs, might be based upon amounts delivered by a 5-a-day pattern that's associated with a healthy endpoint. What are some next steps? And this will lead into our panel discussion shortly. The Food Nutrition Board, in my opinion, should be funded to evaluate paradigms that would facilitate assessment of non-essential food components and how they relate to improved health outcomes. Should evaluate the public health value of these compounds in this process, and to certainly determine what gaps need to be closed. What are some of the classes that could be looked at? This symposium today focuses on the polyphenols, but my favorite set of compounds, the carotenoids, are listed first. Sorry. Classes of dietary fiber might be of interest. Would you say so? Bioactive peptides, a number of other things. Dr. Jeffrey, I put this up for you. The isothiocyanates, omega-3 fatty acids. So some concluding thoughts here. DRIs provide a framework for assessment of essential nutrients. The AI, UL, and totality of evidence approaches could be applicable for bioactives, and a modified evidence-based systematic approach may be necessary. If we use the one that's currently being used, I'm not sure that's going to result in a movement forward for bioactives. So the question I was asked, have we made any progress? What's going on in the last 20 years? We've made a lot of progress on food composition tables. USDA has published a number of those, which Kathy mentioned. Food intake patterns, we know a lot more. We know a huge amount about absorption and metabolism on some of the polyphenols, carotenoids, et cetera. Health outcomes of a number of the selected bioactives, such as the cocoa flavonols. But I can say no, because apparently there's no federal interest in considering public health recommendations for the other food components. The Food Nutrition Board has been trying to generate interest, financial interest from the feds for quite a bit of time, and such a panel has never been brought together. So overall conclusions, the DRI framework as it stands now might limit scholarly evaluation and potential accreditation of some of the bioactive substances. And I think the goal of public health recommendations should be to provide consumers with guidance about healthy food choices that provide both essential and accredited bioactive food components to enhance the quality of life. So thank you very much.